Treatment: dry age-related macular degeneration. So let's talk about genetics. This is a non-modifiable risk factor for the development of AMD. Having blue or green colored eyes and a Caucasian ancestry increases your risk. Furthermore, having a family member affected by AMD increases your risk. The genetic makeup of a person plays an important role. Studies on twins showed that identical twins had a 37% and fraternal twins a 19% chance of developing AMD if the other twin was affected. Several genes have been implicated in AMD, but the two genes most important are CFH and ARMS2. Mutations for these genes may be tested with a specific AMD genetic test that your doctor may recommend or with 23andMe.com. Note that the use of genetic testing alone to predict progression to advanced AMD has not been proven to improve outcomes and is not recommended for routine use by the American Academy of Ophthalmology. However, genetic testing may provide valuable information, and research on this front is ongoing. Smoking. Multiple studies have shown that smoking is one of the biggest modifiable risk factors for macular degeneration. Smoking exposes your retina to harmful chemicals that increase your chance of getting advanced forms of macular degeneration. We cannot emphasize enough that if you smoke, you must stop smoking now. Not only does it lead to life-threatening health problems, but it also increases the risk of developing advanced forms of macular degeneration by almost 3 times compared to people who have never smoked. If you quit smoking, your risk of macular degeneration will be significantly reduced. The risk for those who are previous smokers but have now quit still remains higher than the risk for non-smokers. Tobacco chewing also increases your risk of AMD. Now let's talk about diet. Nutrition is important, and a healthy diet can reduce your risk of AMD. It's important to eat more vegetables such as kale, spinach, broccoli, Brussels sprouts, greens, carrots, green peas. Lutein and zeaxanthin found in them are good for your retina. Try to consume at least 6 milligrams of lutein per day. Eat more fruits. Bright colored fruits are packed with vitamins and antioxidants, especially carotenoids, also known as vitamin A, which has been shown to reduce your risk of AMD by 43%. Eat more fish. Omega-3 fatty acids found in fish are good for your retina and have been shown to reduce the risk of wet AMD by 4 times in one study. Eat less red meat and eat less junk food and processed food. Higher fat intake is shown to increase your risk of advanced AMD. Eat less sugar. Foods rich in sugar can increase your risk of AMD. Exercise and healthy habits can reduce your risk of AMD as well. Exercise at least 3 times per week. Aerobic exercise, as you can tolerate, is a great idea. Obesity is defined by a high body mass index, or BMI. A BMI of 30 or greater increases your risk of AMD by approximately 2.5 times compared to a normal BMI, which is 25 or less. Weight loss and control of obesity can reduce your risk of AMD. Optimize your blood pressure. Uncontrolled high blood pressure is associated with an increased risk of AMD. Flossing your teeth can reduce overall inflammation in the body and possibly reduce your risk of AMD. This is because inflammation plays an important role in AMD. In theory, blue light spectrum of sunlight can increase oxidative stress that can potentially damage the cells in the retina. Most of the light is filtered by your cornea and lens, but sunglasses with UV light filtering and polarized lenses may reduce your exposure to such light further. Note that sunlight and UV exposure have not been shown in studies to cause macular degeneration, but it's still a good idea to protect your eyes and skin from the sun. A specific vitamin and antioxidant supplement may reduce your risk of dry AMD converting to the wet type. AREDS stands for Age-Related Eye Disease Study, which was a large randomized clinical trial that evaluated the effect of a specific formula containing high doses of vitamin C, E, beta-carotene, zinc, and copper on macular degeneration, and it showed a benefit in patients with intermediate AMD or one eye with advanced AMD to reduce the risk of developing advanced AMD by 25% over a 5-year period. Later, a second study called the AREDS 2 study the effect of adding or substituting lutein and zeaxanthin in place of beta carotene. This study was initiated as it was found that beta carotene increased the risk of lung cancer in smokers. Fortunately, the AREDS2 formulation functioned as well as the AREDS formula, but without the increased risk of lung cancer. Note that the contents of the AREDS or AREDS2 are not found in routine multivitamins. Look for the words AREDS or AREDS2 written on them. There's a wide spectrum of such supplements on the market, and the price generally is between $15 and $35 per month. Patients often ask if it's okay to take a multivitamin and lutein instead. Unfortunately, this is not an acceptable alternative. Multivitamins have not been proven to decrease the risk of developing AMD. Research studies have shown that your genetic profile may play a role in your risk of advanced AMD with the use of ARED supplements. Ask your retina specialist for additional information. Now let's talk about lighting. With normal aging, we all need extra lighting for the retina to form images of the same brightness as it did when we were younger. With dry AMD, this need for extra lighting is even more pronounced, but it's often overlooked. Look at this image. What is wrong with this photo? This is how we see under low lighting. Notice how with moderate lighting or high lighting, you are able to see better. It is like how a camera flash makes images better in low light conditions. You may have had good visual acuity on the test chart but still struggle with your vision. The light sensitive cells in your retina are less sensitive than usual and need more light to be stimulated adequately. So it is important to use more lighting. Try using 2 lamps with high illumination output focused on your near activity. Contrast. A variety of electronic devices are now available for reading, such as iPad and Kindle, which enhance the contrast between the text and the background, making it easier